Hey there, and welcome to another episode of In a Bite. As you know, on season 2, we're going beyond just nutrition. We're speaking to other health experts to learn from them and also to find out how these different areas of health are linked with our diet. And I gotta say, I'm really excited for this episode's guest and topic. But first, a question. When was the last time you thought about the health of your spine? Don't worry, I won't judge because I didn't have an answer myself. In fact, it caught me in my tracks. Our spine is a significant part of our body, but it often gets neglected and overlooked when we speak about health in general. Our spine is literally the backbone to all of what goes on in our body. And with that, we actually know so little about how to take care of it. And you and I probably have some pretty poor habits that affect our spinal health on a daily basis. So, in this episode, our guest is here to clear all of that up and give you and I the much needed answers to our problems. As a board certified neurosurgeon specializing in spinal health, our guest today has earned the title of Top Doctor by Georgia Trend magazine for 4 consecutive years, and her recognition continued in 2023, landing her a spot in Atlanta Magazine's Women Making a Mark. Now, alongside her numerous accolades, she has built a huge social media following. Now, we're talking over 2 million collectively on Instagram and TikTok, and she aims to inspire young health professionals while educating the general public about spinal health. Our guest is none other than Dr. Betsy Grunch, aka Lady Spine Doc. We chat about tips to optimize our spinal health, why nicotine could actually be really bad for back health. We also reveal the everyday habits that you and I are making that compromises our back health, and we also talk about the effectiveness of non-invasive practices like physiotherapy and chiropractic treatments in maintaining spinal health. I hope that you enjoy this episode and you'll learn lots from it. And also remember to subscribe to the show and share this episode with family and friends whom you think can benefit from it. Just hit the share button that you see on your screen. Enjoy! How did you get into this niche of neurosurgery and specializing in spinal health?
So I had kind of like a personal story that brought me to medicine and specifically to neurosurgery. I was very much, my mom was like my role model growing up. She raised me as a single mom for the first like 7 years of my life, and I just really, I mean, I loved her. I thought she was like the coolest person. She was a police officer, and did a lot of different things. She was a police officer. She was on the honor guard. She was a police dispatcher, and on the dive team. And she was just a badass, and I wanted to be like her, and I wanted to serve the public. I wanted to be a police officer, I thought, and essentially, like the week before I started high school, she was in a on the job accident that left her paralyzed from the neck down. She was shot at by some perpetrators in her police car and ran off the road and hit a tree. And our lives changed forever. We went from, she went to, from being a 32-year-old healthy, active, bodybuilding police officer to being confined to a wheelchair forever. So it was really just kind of devastating to her, obviously, and to our family, and just life changing. So I really became interested in figuring out like why this happened, and like why spinal cord injury, like that's just it. You just have to accept it, why that is irreversible. So I started thinking about, the spine, neuro anatomy, etc. And I started shadowing her neurosurgeon, and I just wanted to fix people like her. So I decided when I was 13 that that's what I wanted to do. And here I am.
Amazing. So, what would you say, in all these years that you've been in practice, is one of the misconceptions when it comes to brain and spinal health?
I mean, the biggest misconception I think is just that, I mean, in terms of back surgery and spine health, is that back surgery is bad. That you should never have back surgery. No one is ever the same after back surgery. And that's such a huge misconception that I have to like kind of dispel almost every day in my practice, taking care of patients with back issues, because that is so not true. In some aspects, it used to be kind of that way a long time ago when we had a lot more barbaric ways of approaching the spine and diagnostic ways, but now it's, I mean, like I have patients go home. All six of my patients today went home the same day and essentially
Wow,
pain free. So yeah,
that's
so
incredible.
it's a fun field.
It is, and you're really changing people's lives, aren't you?
I mean, it seems like my routine, like just what I do, but it's so fun to see patients come back to see me and just like be so, a completely different person essentially, and it's very rewarding.
Yeah. And what are some of the more common issues that people come to you with?
Um, I do mostly spine, so I treat patients with back pain, neck pain, pinched nerve, sciatica, sacroiliac pain. I do cranial work, so I do take care of patients with brain tumors or with, other types of issues on the brain that might need surgery. But for the most part, I do, just bread and butter, back and neck pain stuff. So.
Yeah. I love how you describe that as your bread and butter. So if we can, just talk about the prevention side of things, right? If we can just go through this sort of life cycle. What are some key habits that parents can teach their children to optimize spinal health from a young age?
I think, spine health is so important, and it's it's something that we kind of are, we don't think about, right? So I think so many people just kind of take our spine for granted, because once you have one severe injury to your back, it can really change kind of what you can do for the rest of your life and in some aspects. So I, encourage everybody to kind of keep a few things in mind. The two most important things, in my opinion, in long-term spine health is keeping a good, healthy body weight. In other words, not being too thin or too undernourished, and two is and not being overweight, obviously, and then two is avoiding nicotine. I think we're so used to in our culture, like really thinking nicotine is bad for your lungs. You're going to get lung cancer. You're going to get heart disease, and it's so underappreciated as to how it can really be detrimental to your spine and your spine health. So those are the two main things. And then the things like lifting properly, sleeping, and good habits of sleeping. Those are all really important things for your brain and your spine.
Yeah. Okay, I've got a question about sleeping, which we'll get to later. And this thing about nicotine as well. I never heard of that, but I'll also touch on that a little later. Now,
Okay.
so just talking about, the younger ages. So, at least here in Singapore, where there's a huge emphasis placed on education, young kids sending them to school and tuition, etc. We carry incredibly heavy backpacks. I remember this as a kid as well. How does this impact spinal development from that young an age?
Yeah, I mean, I think carrying weight on your back is a little better than carrying weight like on the front part, because we're so used to everything we do is associated with bending, or bending over, and extension or putting pressure the opposite way is almost never happens, except for like carrying a backpack or something like that, where you have weight on the back part of your spine. So in some aspects I think it's okay. I mean, heavy backpacks um, are anytime you carry heavy weight, strain your back a little bit. But I do think that carrying heavy weight is kind of almost in some aspects good for your bones, because it stresses the muscles and helps you build muscles and that kind of thing. But you just have to do it in an appropriate fashion, and making sure, like I've seen some kids carrying backpacks on their front part, on their chest, which is not really that great for your spine.
So carrying weight on your back is much better than on your front. Just ensure even distribution, not incredibly heavy. Carry the essentials, basically.
Exactly. Yeah.
All right.
And
And so going to, young adulthood or even adulthood, what are some daily habits that you see going around that compromises our back health without knowing it?
um, let's see. So, I mean, just the things that we touched on kind of earlier is, body weight and not lifting properly. I think a lot of kids like really want to like, be healthy, lift weights, do things, and they do it improperly. And I see a lot of teenagers that injure their back by, either trying to like show off and do things that maybe is not appropriate for them, and herniate a disc or tear a disc or something like that in our back. So those are the things that I commonly see besides like the bad habits of nicotine, like I mentioned
Yeah.
earlier.
How about things like, just your posture at home or, we're using so many screens today. How does that affect our spinal health?
Yeah, that's a great point too. I mean, posture is something that I think is like it's behavioral. Like we get used to doing things a certain way, or holding our phones a certain way, or reading our books a certain way. And yeah, like having good habits about posture, even holding your phone, or we call it text neck, or
Hmm.
you might whatever, just leaning over and bearing weight on your spine in a flex position is in general bad, and even like desk ergonomics. So I actually did a video with a physical therapist the other day just teaching basic desk ergonomics of working at a computer and sitting down and trying to keep your eyes level, keep your spine in good position in your chair and your arms, and how you use your mouse, and all those little things are good, just kind of overall habits to have in terms of um, keeping yourself healthy and your joints healthy. So, yeah.
Yeah. Well, it's funny, just as you were talking about that, I literally just uncrossed my legs because I was once told that that's not good for back health. Is that true?
It just goes back to the same posture and stresses that you put. But crossing your legs, is twist your pelvis a little bit and put some unequal weight on your spine. And actually, you can get from prolonged crossing your legs, you can even get a peroneal neuropathy, which is where you can kind of press. There's a nerve on the outside of your leg. So if you cross your leg too much and you put a lot of pressure on that part of your leg, you can actually, sometimes it's rare, but you can get nerve damage to that nerve as well.
It's funny you say that because in recent years, whenever I stand up from crossing my legs, I literally feel pain and some numbness in that area. So,
There you go.
okay, that's all right. Good reminder for myself. Another myth that I want to bust, if it is a myth, um, I keep hearing that good posture means sitting up straight. Although in recent years, we're talking more about maintaining that S curve. What are your thoughts on that?
Slouching and things that teenagers and young adults just get used to doing, is kind of counterintuitive, especially in that growth period of our spine and when our spine is kind of developing. It can be, somewhat harmful. I don't know of a lot of data that supports that, but I think that kids mature, and the good news is that kids' spines are totally malleable and flexible, and young adults, it's like, I am in my 40s now, and so there are things that I could do when I was reading my book when I was in college, and things that I could never do now the same way, like leaning in my bed reading a book with my legs all twisted. Like, no, I would wake up, not be I would like undo my legs, not be able to walk.
I
So
know. Yeah, I used to lie in my bed on my tummy and, prop myself up with my elbows, like the classic book reading position. And then my mom used to tell me off. So would you say that for young kids, oh, it's fine. You can, you're still young, your spine's malleable, you can go into all these positions? Or is it that kind of thing where you're like, nah, as early as possible, try not to get into these, put your spine into these positions?
I mean, I think for young adults and kids, it's totally fine. It's just more of the habit forming, I think, and
Yeah.
long term things that you kind of do. I mean, I wouldn't say it's damaging anything, and by doing certain things, but it can be more of a habitual learned bad behavior, if you will, that may come back to haunt you later.
Oh,
So,
for sure. In my case, clearly. Now I wanted to talk more about nicotine. I mean, this is so interesting. I've never heard about the relationship between nicotine and back health. Could you share more about that?
yeah. So, if you, the nicotine is found, and I like to use the term nicotine addiction instead of like smoking, because there's so many different ways now that people use nicotine: dipping, vaping, gum, patches, all those kinds of things. So, nicotine is really the bad actor. It's not really the cigarette or anything like that. But nicotine, if you think of what it does and how it's addictive, it's a vasoconstrictor. So, what that means is it causes your blood vessels to constrict or to close down. And so that's how it can deplete oxygen from areas in your lungs and your heart and cause damage. And then it also will cause buildup of atherosclerosis, or badness in your blood vessels, and damage your heart and lungs that way. On a similar token, like our discs in our spine, the little cushions between the bones at our spine, are hydrated. So those are like the shock absorbers of your spine. They are not very well vascularized, so there's not a lot of blood supply to those discs. They're relatively avascular for the most part. So they receive, if you bend over and pick up something heavy, and let's say you just kind of injure your disc, those blood vessels will come in and heal your disc over time, and kind of rehydrate it, give it nutrients and water so it can kind of juice back up, so to speak. And then if you use nicotine, that vascular supply that's already very poor, it compromises that. So people might pick up something and then not heal their discs as well, and then repeat that over 10, 15, 20 years. And you have very accelerated degenerative disc disease in young people that they may not have had if they didn't use, nicotine products for a period of time. So I think it's something that we should talk about more, and I think it's very useful, because I tell patients this all the time, and I would say almost 80 to 90% of the time I am the first one that's ever told them that.
Yeah.
And it's kind of crazy. And I don't do spinal fusion. Is something that's very common in spine surgery. We If we have to fix someone's back that has a slip disc or something like that, sometimes, not all the time, we do a fusion, which involves bone and screws and trying to get a part of your spine to grow together. And 50% of the time in people that smoke, they don't heal. So I talk to my patients about nicotine cessation or quitting smoking, or using those products before surgery, before we'll do an elective surgery. So yeah, I mean, it's amazing. I always thought initially when I went out into practice that I would lose patients by doing that, because I think they would just not want me to be their doctor. But it's shocking how many patients are like, I'm done. I'm gonna make myself better. So I think if that's encouraging, and that happens routinely, that if we taught that to kids in school, and if people knew that, would that change behaviors?
Absolutely. And look at you killing two birds with one stone there.
Yep.
Stopping smoking and improving back health. I never would have thought of that. Wow, this is fascinating. And do we have any data that looks into short-term and long-term nicotine use? So, for example, if you used to smoke as a teenager, but you no longer do as an adult, does that do you still suffer the long-term effects of nicotine use?
I think in most data, and I don't know any of off the top of my head, but in most studies looking at like the reversal of the effects of nicotine after cessation, it usually takes, a period of time. It is somewhat reversible, though. I think if you damage your disc, though, you know, you can't like re-heal them after a period of time. Usually that damage is done, so that healing process is pretty quick. So in other words, if you injure your disc, usually within 3 to 6 months it'll heal. But if it doesn't heal properly, it's not going to in like 2 or 3 years out. So
Gotcha. Okay, well, that's really good to know. So more on the practical tools for adults out there. You mentioned sleeping positions earlier on. So if we can just talk a little bit about pillows and mattresses. I know you've done some videos on this as well. What's the key thing to look out for when shopping for them?
I think the most important thing is really finding the sleep position that keeps your spine in neutral alignment. So your spine, like you mentioned, has curves, and but if we look like longitudinally or straight up and down, our spine should be straight. So if you side sleeper, which 75% of the population are side sleepers, you know, a good supportive pillow that kind of fits in that shoulder and head area to support it is important. Like a more firm pillow is what I recommend. Soft pillows are squishy and fun, but as you lay on them, they'll kind of mold and sink, and then you'll wake up, kind of fluff it back up, if you will. But if you had a supportive pillow that was like that all night long, where you didn't have to refluff, that supported your spine, that's a type of pillow that I recommend. In addition to I've talked about in some of my videos, but like a knee pillow or something you place between your legs to keep your hips in alignment too. And I was born with hip dysplasia, and I've had a hip surgery before. And if I don't sleep with my pillow between my knees, I will wake up and regret it. So, I mean, it's important for not only your hips, but your lower back too. So,
Amazing. I'm smiling because I have a question later about this knee pillow, which we refer to as a bolster here in Asia because it's so common. And I too cannot sleep without it, but I will get back to that in a little bit. So when you said the best sleeping position is one that keeps your spine in neutral alignment, how do we know what that neutral alignment is? How do we tell?
So you want your neck to be in perfect straightness with the middle part of your chest. So if you kind of look at yourself, and this seems kind of weird, but you can even get a mirror and put it on your bed, in front of your bed, so you can look at yourself when you're lying on your side, just making sure that your neck is not too
Yeah,
lifted or too far down, and just, basically right even with the middle part of your chest. And it's good. And then some people that are not used to sleeping like that, the first couple of nights may actually feel different or hurt because you're not used to sleeping in a normal position. So, and people that are kind of adapting to a new pillow or a new sleeping strategy, I always encourage to give it like at least a week, because I think it can be very, very helpful for your pain if you're one of those people that wake up with neck pain or back pain
for
in the
sure.
morning. So,
Awesome. Well, I feel really good about myself right now because I recently got a new pillow. Well, my mom got it for me. She's based in the US, and obviously you guys have all these, amazing products. My boyfriend calls it the alien pillow because it literally has all these grooves in it, but it's really cool. And it really supports this, like or rather, when I lie down on my back, it has these like little puffy bits on the side of my neck, and it supports me when I sleep on my side. I've never slept better. I used to wake up with neck and back pain, but now it's just completely gone. So I will go find out the name of this pillow, and I'll make sure to add it into the show notes. But those are very practical tools. Thanks, Betsy.
yeah.
So the next one I want to talk about is scoliosis. So this is fairly common here in Singapore, and I'm sure globally as well. What are some prevention and management tips you can share with us?
Um, Prevention is tough. I mean, most scoliosis cases are idiopathic or neuromuscular, meaning that like it's not like out of like bad habits or anything. It's just kind of one of those things that can happen in some kids. But I do think, if we're talking about adolescent scoliosis, because there's really a couple of different types. There's the scoliosis that is kids get. That's why we screen kids in elementary school. And then there's scoliosis that develops later in life, or degenerative scoliosis, and that can happen for a many variety of reasons. But all the same things that we've kind of touched on already: sleep positions, spine health, all those things can help prevent scoliosis. Because what happens is, if you, let's say you injure your disc, and like one side of your disc kind of asymmetrically degenerates, and you get this twist of this part of this one segment of your spine, and then you multiply that over years, your whole spine may start to kind of be like the leaning tower of Pisa, just kind of accommodating that and the different forces that go on to that. So yeah, I think it's important. I talk about traction with my patients. I personally use traction like an inversion table too. I think that that just kind of helps stretch the spine, whatever techniques and strategies that you have. But stretching, yoga, Pilates, all of those different types of exercises can really be helpful to keep your spine flexible and mobile as well, and prevent things like scoliosis.
Right. Because I was told as a kid, we used to get screened in school as well, that because you're tall, Charlotte, you are more likely to get scoliosis. Is that true?
Not necessarily. I think that sometimes, though, tallness can be associated with connective tissue disorders. So,
Mm,
patients with Ehlers-Danlos syndrome, if you've ever heard of that, but hypermobile diseases,
that's me.
patients are usually kind of, yeah, tall, lanky, and they are more prone to getting scoliosis. So, yeah.
Oh, interesting. There you go. Yeah, you're speaking to an incredibly hypermobile person here, so I totally get where you're talking about. And earlier on, you mentioned that people have this misconception that surgery is bad, and for that reason, they look into alternatives like physiotherapy, yoga, wearing a brace, and to what extent are these effective?
Um, I mean, I think for any spine condition, if that you may have the almost always we talk about physiotherapy or physical therapy. It is so important to kind of start basic when you have any type of injury to your spine, to really work on, strategies that you can do in a conservative way to help improve your thing. Bracing is kind of controversial. I don't, it depends on like kind of what the issue is whether or not bracing can help. But I do think that absolutely trying conservative treatment is the mainstay of most spine issues, because not always, and I don't know how it is where you're at, but in America, people want a quick fix. And it's so, yeah, it's frustrating. They have one pain, they want it gone. They want, they'll come in and have this ideation that I'm going to like wave my wand and make them better. And, it's not all, most of the time, it's not that easy. So.
Yeah, trust me, as a nutritionist, I face that on a daily basis as well. Everyone just wants that silver bullet. I mean, I understand, right? We're all time strapped. We want something that's quick. And so, going back to that point, at what point should someone seek help from someone like you?
Um, I mean, I think if you have any type of back pain or neck pain that's new or just happened, that's not really, you know, usually that concerning. Almost, 90% of the population at some point of their life will have acute back pain. So those types of things are really common. Most of the time they self-resolve. 80% of the time these conditions self-resolve. But reasons why you should reach out to or seek the advice of a spine specialist would be persistent pain that doesn't get better with conservative treatment like physical therapy or chiropractic treatment, over the counter medicines, etc. Any numbness or weakness may be concerning as well for severe compression on a nerve. So if you're having any of those, severe debilitating pain, numbness, weakness, or trouble walking or balance, those are all reasons that you probably should see a specialist.
Okay, that's yeah, that's a good tip. I think numbness is never a good sign, so definitely seek help. So now, when offering patients recommendations for brain and spinal health, do diet related ones come up?
Say that one more time, sorry.
Do diet related recommendations come up for brain and
All the
spinal health?
time.
What are
All the
those?
time. So I mean, I think that I'm just going to get on my soapbox for a minute and say that and you probably already know what I'm going to say, but in medical school we're just not taught enough about nutrition, and how nutrition in our diet really plays an interactive role in our health, which is really kind of terrible
Yeah.
because I mean, I really think it's the mainstay of a lot of health problems is bad diet, and particularly with the spine, not only as it relates to your weight, but in terms of inflammatory foods and things like that, that people just don't have a conceptual understanding, including me up until like probably about 5 years ago when I really started trying to educate myself on it. So yeah, I talk almost, I mean, several times a day when I'm in the office seeing patients about nutrition and how patients can avoid certain types of foods if they have chronic pain or, their weight and things to try to improve that. So yeah, it's very important.
What are, would you say the three most common dietary tips that you give out?
So number one would be avoid um, inflammatory foods like highly refined sugars and gluten. I talk about that a lot in patients with chronic pain, and it's not just like back pain, but like overall joint pain and inflammation in your body. I think that can make a big difference in a lot of patients. And then, at least in America, we have so many processed foods and things, and it's easily accessible, and it's something that's cheap. And so I think a lot of populations of people can afford that easily, and it just becomes habitual, and it's very unhealthy. And a lot of it's, like I said, socioeconomic, which,
Yeah.
you have bad nutrition because of their access to food that leads to bad health later on. And it's just kind of this cycle. And then lastly is just, trying to overall just kind of keep an eye on your caloric intake and how that affects your body weight. So
Yeah. Pretty simple, straightforward stuff, huh? You mentioned gluten, and I just wanted to expand on that a little bit. So, are you saying gluten for the general population or for a certain subset, people who are celiac, for example, or gluten intolerant?
I think there's a lot of people that are gluten intolerant. I mean, obviously most people aren't, but I do think that there is and not so far as to venture into celiac disease because that's really uncommon. But there's a lot of people that are just gluten intolerant and they don't know. So I often encourage people to kind of like try to eliminate certain foods that may be kind of associated with pain conditions and see what they do. Like, you don't want to cut out too much at one time because then you don't know what you did that actually
Yeah.
improved. So I'll often talk to them about, okay, well, let's, for a week, cut out like this part of your diet that's pretty routine to you and see how you feel, and then reintroduce it and see if some of those symptoms may come back because I think that so many people just kind of don't think of those simple, really things that you can do that can really improve your pain. And I always almost hesitate to tell people that because they're coming to see like a neurosurgeon and they don't expect to get like dietary advice from me, but I'll say, I'm just our goal is to really kind of improve your overall health and how we can get you better maybe without surgery. And so these are just some tips to try to help that. So it's kind of fun to see how people respond to different changes in their lifestyle and help them. So
For sure. So the main principle here is avoid inflammatory foods. Include more anti-inflammatory foods into your diet.
yes, yeah,
Do you
and
speak?
and and processed foods,
Yeah.
yeah.
Do you speak much about vitamin D by any chance?
Yes, I didn't touch on that, but yeah, I mean, bone health and spine health are so deeply integrated. Um, I think women's health is something that's so undertreated and underdiagnosed, particularly osteoporosis. Um, in my practice, I see patients with compression fractures all the time. I see patients that are never screened for osteoporosis, never talked to about their bone health, and then it's too late. They've got such terrible bone that they're susceptible to breaking bones in their back. And so, yeah, I mean, vitamin D is very important in both the diet and getting sun exposure and those kinds of things. And it's something that you need to do early in life because you only really build bone until your 30s or so, and then by that time it's all downhill from there, and there's nothing that
Mm-hmm.
you can do to improve it. So yeah, I think if we talked a lot more about that in early adulthood, it would make a big difference in people's long-term bone health when they're older.
Yeah, absolutely. If not for my studies in nutrition sciences, I wouldn't have known that, we reach peak bone density in our 30s, and after that, like you said, it just goes downhill. And so our diet and our nutrition in the first 20 years of our life is crucial. And it's funny, and I don't know if this happens in the US, but at least here in Asia, we hear a lot of adults saying, "Oh, you're young, it's okay, you can just eat whatever you want," and I can understand that notion, but gosh, in our developmental stages, nutrition is just crucial, and you
Yeah,
can't make up for
exactly.
that in the later years.
That's right. And, bearing weight, like weight bearing activities is also really important for your bone health. So just doing like Pilates or yoga or whatever is not as good for your bones as lifting weights or something of that nature. So,
Yeah. What would be the ideal age to start these weight bearing exercises?
I mean, as early as possible in, late teenage years.
Okay.
But, even adults well into I've seen women in their 70s and 80s, start lifting weights, which it should be done earlier, but I think it's beneficial in all ages. So
Yeah. It's never too late to start. Look, I'm still trying to convince my mom to lift weights. So hopefully, after listening to this, she would pick some up. Um, so now,
perfect.
going into some of your personal habits that you practice to maintain good spinal health, what do those look like?
So it starts from really, my sleep routine. All the things that we mentioned earlier about trying to sleep in good body alignment. Um, and then waking up in the morning, I work out, I do weight bearing exercise in the morning, or cardio. I just kind of vary in back and forth. As soon as I'm done working out, I do a stretch, and that includes like a slight inversion to help my neck and back. And then, just going to work every day. I mean, being a surgeon is not very accommodating to the spine. We're leaning over all day and doing things, but simple things that I do to try to minimize that, like use visual aids, like I have loops that I can wear so I don't have to look down, or microscope. And then, like, even the shoes that I wear and the compression socks to help my feet not help to relay that pain to my back from standing all day. Those are things that I do every day, keeping hydrated. I wish I could say that I did that well, but I tell myself that I will. Um, and
Look, we can't be perfect.
That's right. That's right. And then, just going back into that, like just kind of ritual at the end of the day, trying to stretch. I'll try to do some neck extensions and stretching. And I really love, like, I have a Theragun, which is like a trigger point gun, to kind of help release some muscle tension. And I think it helps me go to sleep better too. So I can tell the nights that if I have insomnia, the next night I'll use my Theragun and I sleep like a baby. So
Oh, amazing. Who would have thought?
yeah, I think it just kind of releases the tension that you have and breaks up some of the muscle tightness and toxins that are in your muscles. But yeah.
Right. And so what is this spinal inversion that you spoke about? What does that stretch look like?
So you may have seen, I use a inversion table, but it's essentially like a board that you lay on, that you lock your feet into position, and you can safely just kind of take, your body, turn it at like 30 or 45 degrees. A lot of people think that you're supposed to be completely inverted, which is not the case. That can actually, like, cause problems, but just a little bit of stretch. And it doesn't have to be inversion. It can be, you know, you've probably seen those big exercise balls that the bouncy balls that you have in the gym.
Mm,
You can just kind of extend your back over one of those and just get a good reverse stretch of your spine. Because, like I said earlier, we're really always leaning forward and putting our spine in flexion, and rarely do we go the opposite way. And so, over time, if our muscles aren't used to extending, we're just going to become more and more kyphotic, or more and more leaned over time. So stretching and doing those types of small little things in your everyday routine are important. And I failed to mention, I haven't mentioned yet, but core strength is so important. I mean, so many women,
mm,
and I say women because it's usually is, women that have pelvic floor and core weakness from whatever bad habits, delivery, carrying babies, pregnancy, um, all of those things that kind of really affect us long term too, in terms of our support for our spine.
For sure. So going back to these inversions, say if someone doesn't have, you know, the gym ball, or they don't have this inversion table, are there any, could you use your sofa for this?
Yeah, I mean, you can, I think just backwards, like leaning back over something, even a pillow,
Okay.
something that'll kind of just give you a little bit of not too much because you don't want to do too much extension, but just a little bit to kind of give you a gentle stretch. The inversion works better than just using, like I said, the ball or a pillow like we described, because you get a little bit of gravity pull with it.
Mm.
But I think all of those, there's not a lot of data to support that all this helps, but I think that just these stretches and stuff are good for our overall just mobility, which will help our back long term. So
Look, it feels good as well. It's a good way to
it
release
feels good.
tension. Yeah,
That's right. And, I think that I don't want anyone to think that they need to run out and buy an inversion table, because by any means, there are some contraindications for certain conditions you may have that you may not want to use it for. But I do think just kind of keeping those little tips in mind to keep your spine moving. So,
for sure. All right. Well, Betsy, you've shared so much. I've just got a couple more questions to go, and these questions were sourced from my followers on Instagram, and I handpicked some that I thought would be really relevant to our conversation. So one is, does waking up with a backache or cervical spine ache warrant you to see a doctor for back pain?
no, I think that is very common to have some type of pain or ache whenever you wake up, or if it's acute. But if it's anything that you're concerned about, I never want to discourage anybody from seeking medical advice, particularly if it's all of a sudden type pain. All back pain is not equal. I mean, you can have something severe like an aortic dissection, which can be life threatening, and that can present with back pain. So if it's something extremely severe, it should warrant medical attention. But if it's just a tweak or an ache in your back, most of the time those can be safely managed at home with at-home remedies.
And like you said, a good pillow.
And yeah,
It's one of my main takeaways today. Um,
that's right.
Another one, and this is such a good one. Is it safe to crack and adjust one's back through massages or chiropractic treatments?
That is a common question that I get. I think, it's kind of like popping your knuckles, or a lot of people like to crack their neck. It's it there are risks to everything we do like that. I personally don't like popping or cracking your neck. There are vital structures that are in there, including your vertebral artery, which is an artery that goes to your brain that actually travels through your spine. And I'm sure we've all seen these videos on social media or in the news where someone gets a adjustment to their spine and is paralyzed. And it's because of that. Our vertebral arteries are not really fragile, but they can be injured by sudden twisting or popping. And so I don't typically suggest that anyone that is completely safe practice to do. When you do pop your neck or crack your neck, I mean, or any joint in your body for that matter, you're just releasing air from the joint, and over time that may or may not contribute to arthritis. So I think getting a good neck or thoracic or low back adjustment is, for the in general, mostly safe, but we take risks with everything we do.
For sure. Yeah. I mean, I've never been a fan of chiropractic treatments. I used to get them as a kid, and sure, it feels good, but it never really lasts very long.
Yeah, I mean, I always am a little skeptical about kind of getting into chiropractic discussions, because there's a lot of people that they're in favor and not in favor, and it's controversial for whatever reason. But there's not a lot of good scientific data surrounding chiropractic medicine. And I am a firm believer in science and evidence-based medicine. And I mean, a lot of the things that I just talked about today aren't evidence-based medicine, like pillows and stuff like that. But in general, I think if it feels good, is there a reason to not do it? No. I mean, go ahead, get your adjustments. Are they almost always relatively safe? Yeah. But if it's something that you're using to treat a chronic medical problem that's ongoing, you're not getting any better, I would suggest that you seek the advice of a spine specialist, just to kind of get another
Yeah,
eyes on your problem and see what's going on.
for sure. That's really good advice there. So now going back to the topic of knee pillows or bolsters, as we refer to here, what's the impact on sleep? I mean, earlier on you mentioned that it provides support to the hips. How does that work?
The same reasons why, a pillow would work on your neck. It keeps your legs and your exit out your pelvis from the outside portion of your pelvis is where your femoral heads exit. And so there's a certain space between there. And so if your legs kind of collapse as you lay down at night, you're putting strain where those joints aren't perfectly straight, and that can put stress on your hips and your pelvis and your lower back. And so by keeping a pillow to separate your knees to a reasonable normal distance, it will help with that alignment and help take some tension off of your lower back, which may result in improved pain when you wake up in the mornings.
Awesome. Well, now I don't feel so bad about using a bolster anymore because I cannot sleep without one. Over the holidays, I was traveling, and I mean, you only have one pillow, right? You don't have the usual stuff you have back home, and I had to like stuff a few sweaters together and put it in between my legs because I couldn't sleep without it otherwise.
Yep, I love that. Yeah, I will sometimes take two or three pillows when I'm at a hotel and just
Yeah.
shove them between my legs.
Yeah, I even went online to look for an inflatable knee pillow because I was like, I cannot do this anymore. I need a solution going forward when I travel. So yeah,
That's amazing.
yeah,
Did you
that's
find one?
no. In fact, the search led me to some pretty odd results. So I will not go there. So
Love that.
the last question we have here is about cervical degeneration. Someone asks, can it be reversed?
I think a lot of degenerative disc disease almost always can't be reversed. I think that's the part about the spine that's really just kind of a bummer, is that once you kind of injure the spine, it rarely kind of goes back to normal. But I think a lot of people have the misconception that for the most part, it is progressive, but you can halt the progression of the disease by changing some of your health habits and improve your pain. And natural wear and tear and degenerative disc disease is part of the aging process. So you will almost never see a 70-year-old that comes in with an MRI that's normal, because we will naturally age our spine. And so really defining what's normal and abnormal for your age group um, is is something that you can talk to about with your doctor. But I have patients that come in with, they have an MRI done and they get this report and it has all these problems on there, and they freak out because they think that, that they're in a bad shape. But for the most part, I mean, all that kind of stuff that we see on imaging, and a lot of it is age appropriate. So however we can age our spine, the less as possible is the goal here.
Yeah. And aside from, some of the tips that you shared earlier, like, keeping a healthy body weight and avoiding nicotine, how can one slow the progression of these degenerative diseases?
The things you mentioned: exercise, eating, trying to eat healthy, stretching, and just trying to avoid extreme physical exertion, like lifting really heavy weights, or doing something extremely stressful on your body is often very helpful.
Yeah, yeah. Okay. Well, it's good that, we keep going back to the same tips. It's very similar to nutrition. I always tell people it's boring. It's really boring. It's super basic, but boy, it works. Just do it and
Yeah,
you'll see the
yeah,
results. The
yep.
last one I wanted to ask about, because I didn't get to expand on this earlier. So, compression socks. I see my dad wear them all the time, and I thought it was just for deep vein thrombosis, but there is a link to back health. Could you? There you go. There you go. Do you have them on all the time?
Almost all the time, yeah, yeah.
Oh, wow. So, could you explain the mechanism?
Yeah, so I mean, most of the time, and when we're awake, we're putting our legs in the dependent position or below our heart, and our blood circulates where it goes down to the tips of our toes and has to come right back up to our heart to recirculate. So the longest part that our vessels or our blood has to travel back is from the bottom of our feet up. And so we have obviously arteries and veins that pump the blood down and bring the blood back up, and our veins have um, valves to help push the blood back up. But over time, they can be damaged, and so the compression sock will just kind of add some extra support to help with that stasis or that stagnant flow of fluid, lessen swelling in your legs. So that'll lessen achy legs, and then that in turn will probably help with lower back pain and other health problems. So um, for me, I can tell if I do not wear my compression socks one day in the OR, I immediately like I can't do it. So despite how they look, I don't really care. There are plenty of cute ones out there. They are so great for your back. I don't wear. I probably go like maybe 1 or 2 days a week where I'm not wearing them. So
Wow. Who would have thought? And how long should you wear them for? I mean, is there any negative effects to wearing them for too long? Is there such a thing?
not really too long. I mean, you want to get a pair of socks that's like fits you appropriately because you don't want to like, right at where the top of the sock is. You don't want it to like compress the skin too much and might can cause some skin issues. But no, I mean, some people wear them 24 hours a day. I mean, I don't think it's necessary to wear them when you're sleeping because for the most part, your legs are, kind of in line with your heart when you're sleeping. But unless you sleep in a recliner or something like that. But yeah, there's no harm to wearing them, however long that you can tolerate them. So.
Okay. Well, I'm going to get myself a pair because I used to think it was something for, people in their silver years. But clearly not. We can all benefit from that in our earlier years. Okay, so people listening to this, you got to get a new pillow, got to get new mattress, got to get a compression socks, a knee
Yep.
pillow. So last question for you, and as a nutritionist and food lover, I can't not ask this question. What's a dish that you haven't had for a while and that you yearn to have? It could be something nostalgic or just a dish that you miss you haven't had for a while.
Oh my gosh. Oh, definitely probably chicken and dumplings. I don't know if you know what that is, but it's a really classic Southern American dish.
Ah, okay.
Um,
Sorry. When you said dumplings, I just thought immediately of Asian dumplings. So we're not
yeah,
talking about
no,
stuffed dumplings. Yep. Okay. I gotcha. Yes.
no, no, although I do love dumplings, but I have those Asian dumplings all the time. My husband's half Korean, so we eat a lot of Asian food here.
Amazing. I
Um,
love that.
but no, they're very American dumplings are kind of like Asian dumplings, except they're not stuffed.
Yeah.
So they just dough basically and chicken, and they're so like the dumplings are extremely high in carbohydrate. So I don't eat them, which is why I yearn this dish because it's so good. And then probably the second thing I would say is biscuits and gravy, which is a very,
Yes.
yeah, it's so good, so good.
Oh my gosh, we have this restaurant here in Singapore. It serves Southern American food. Oh my gosh, the biscuits, they're so good.
They're
And
very
do you have
good.
a favorite spot in your hometown that you go get these, chicken and dumplings and biscuits and gravy? Or do you just whip them up at home?
I mean, I definitely cannot whip them up at home. I am not, no. But you may have heard the Cracker Barrel. They have the best chicken and dumplings. It's a very classic Southern chain restaurant, but they have some good chicken and dumplings, and that's probably my favorite.
Amazing. Okay, well, if I find myself in Atlanta one day, actually have been there on transit, I will look out for that.
There you go.
Thanks so much, Betsy, for your time. I learned so much, and I now have a shopping list to go execute.
Let me know if I can help.
All right, thank you, and take care.
Thank you so much.
Good
All right.
night.
Good night.
Bye.
Bye.
Oh, that was such an enriching conversation. I learned so much. And like I said, I've now got a huge list of items to shop for. Definitely getting those compression socks. Gonna look for cute ones, of course. And who would have thought that relationship between nicotine and back health? I think that's one of my biggest takeaways today. And of course, I'm going to put the link to my so-called alien pillow in the show notes. So, if anyone wants to check that out, you can do so. Totally not sponsored, but truly, my mom got it for me earlier this year, I think around September. It was the best thing ever. I almost wish I can pack it with me on my travels. Now, I hope you enjoyed this episode. Don't forget to rate the show so that we can keep bringing in content that you can all enjoy. And for more nutrition content, follow me on social media and subscribe to my weekly newsletter. You can find all the links to that in the show notes. See you in the next one. For the full transcript of this episode, head over to my website, thecharlottemay.com/podcast.